One thing that we've all come to realize over the past a year and a half now, almost it's been, is that we are all connected. What I do impacts you, what you do doesn't, it impacts the next person. And so let's hope that this is the conversation that we've all needed to really bridge and bring our communities together. But even prior to the pandemic, another organization has been trying to do that. Healthy Pontiac, we can. And with that, we want to go ahead and bring in Lisa Braddix, Elizabeth Crenshaw, and Jessica Williams. They are with the Oakland County Health Division, Healthy Pontiac We Can. And I know the three of you are in two different locations, but if we can, we want to go ahead and let's start with Lisa. Tell us, what exactly is Healthy Pontiac We Can, because you started prior to the pandemic.
Sure. So so glad to be here. Thank you for the invitation and the opportunity to share about Healthy Pontiac We Can Coalition. And basically, it is indeed a coalition. And I love how you just said we are all connected, because really that's what it's about. It's really about bringing various individuals and organizations in Pontiac together to really figure out how we can get everyone to be able to live the healthiest life that they can live. And so we are an organization of organizations and individuals who really have various resources that they bring to the table. And we're all about collective impact and how we can pool our resources and work together and collaboratively to really foster a healthy environment for the residents of Pontiac.
Elizabeth Crenshaw, I'll put you on the hot box here next of the questions. And with that, I know that you started this prior to the pandemic, but then you were just getting up and running and the pandemic hits. So Elizabeth, how did the pandemic sideline your work in the beginning, but then how did you recover?
Yeah, so I wouldn't even say it was sideline. I would give it more of a positive spin. With the Healthy Pontiac Weekend Coalition, we have so many community-based organizations, faith-based organizations, the Oakland County Health Department, and so many community and champions that are hands on the ground. So what we saw during this process is everyone came together. So it was an increase of participation from not only our health department, but community-based organizations and our community members that rallied together to provide resources for our community members. So even though during this time we did kind of had that delay, it brought so many more people to the table. We brought so many more ideas, and it really gave us a more broader perspective of how we can serve community members in Pontiac.
And so with that, Jessica, I know that you're the public health educator there for the health division. So what's it been like for you to try to educate people not only about Pontiac We Can, that mission, but also in the middle of the pandemic, which we've never experienced, and the information has changed so much throughout the year?
Yeah, so what a time to be in public health. I will definitely say that. It's been, a wild year and a half, but through Healthy Pontiac We Can, as Elizabeth had mentioned, we really rallied together, and as a public health educator and kind of the behind the scenes staff person for Healthy Pontiac, just trying to push out as much education and information to the community as possible. As health department employees, Oakland County really came together, and our work was ever evolving, and we just rolled with the punches and did what we could for the best of our community. So proud to be a public health professional, that's for sure.
So I will ask you too, because my niece just graduated from the University of Michigan in public health. She started out pre-med, then kind of shifted public health. But for you, if I can ask you, Jessica, did it kind of help that the program was so new and that you were still kind of not entrenched in how things were done before, that you were still kind of developing the program, so that allowed you to reach and educate more people?
So actually, Healthy Pontiac was started back in 2011.
Is it that
through
long? Because there was a survey in 2018, I think I remember taking.
Yeah, so we actually just wrapped up a survey for 2021 as well. So every 3 years, the coalition does a Pontiac community survey. So we do a scan of community members, residents of Pontiac, to kind of get a pulse on barriers or assets that they find in the community, things that they would like to see improved, things that we can kind of come together as a coalition to push forward this work. And so you are correct. We did do a survey in 2018, and we established a strategic plan from that as a coalition to kind of have these specific objectives that we wanted to work towards. And it was kind of perfect timing that we were scheduled to do another one for 2021, because if anything, I think we can all agree that the past year and a half has really given folks a different perspective on their health. And so we received way more interest in the survey. We had way more responses. We had so many more community members that were engaged, wanting to help distribute, get the word out, so that we could really get a good sample of the community and say, okay, we've, made it past the, this past year and a half. How can we help move this work forward, moving forward?
So, Lisa, before we get back with you, if I can go ahead, Elizabeth, since you're right there, how has the past year and the results of that survey shifted the focus of Healthy Pontiac We Can? Or has it?
Yeah, so I think it just added to the work that we are already doing. I know for our organization, we're looking at, tackling the social determinants of health, and there's so many needs in our community in Pontiac. So with our health initiatives, our health and wellness, our physical education and activities that we plan for the community, it really gave us a unique platform to support that, because during the pandemic, a lot of people were inside and weren't at the gym or weren't as active. So we've shifted and morphed to really support the needs in our community. We've came together in health initiatives and educating on healthy recipes and really highlighting key members in the community. And we have this community champions where we just highlight members that are doing the work in the community. So I think it really elevated, and it really showed us pockets of how we can do more to serve our community members.
So, Lisa Braddix, if I can bring you back in, you're one of the co-chairs. Do you feel like kind of the pandemic, one of the focus that came out of this, number one, the importance of our healthy lifestyles and food fueling our bodies and being a medicine for our bodies, but also the inequities of healthcare within our industry. And now that that's been so much of the focus over the past year and a half, do you think it's going to help you in your mission going forward? Because I would kind of think that you guys probably already knew these things.
Mm-hmm. Absolutely. You're absolutely right. I'm a public health professional. I also graduated from U of M School of Public Health many years ago.
Go Blue.
And so I've, been very, very steeped in the understanding of the social determinants of health and how important it is to be able to access healthy foods and opportunities to be physically active, all of those conditions that really contribute to a healthy lifestyle that can set you up for, being able to go into things like we just experienced, this pandemic, in a good position to be able to navigate your way through. And I, someone who is a public health professional, anyone who has worked, in even healthcare, kind of has an understanding of this. But I think it just was highlighted, especially in these times, and with people seeing on the news, how this has played out. I think now people may have a heightened focus and attention and an understanding of the importance of these things. And so I think that what Jessica was talking about earlier, what an interesting time it is to be in public health, and what an interesting time it is for us to be doing the work. And I think that we're going to, come out of this stronger and with even more galvanized support for the coalition and the desire for people to be able to live a healthy lifestyle in Pontiac.
So if I can ask you, Lisa, I will say I did a homeless retreat some years ago in the city of Detroit, and one of the most upsetting things that you discovered was there was no healthy food available to our homeless, and we know that kind of pours over into our low-income families as well. It's so much processed food or peanut butter and jelly, anything that you can get, because it needs to have a shelf life as well. But people go through these situations, but we also know as Americans, we have such a short attention span. So how do we take the things that we've learned and those emotions that we gained from that and carry it over into action?
Well, I think that you're absolutely right. This is America. We do have, short attention spans, and we're kind of really wanting instant change and instant everything. And I think one important thing to understand is that we did not get here yesterday. And the amount of time that it took us to get here and into the situation that we're in terms of access to healthy foods, for example, it's going to take some time for us to get out. And I think it's going to take efforts like what we're doing with the coalition to continue to heighten the attention, to continue to bring more people to the table who have decision-making power. For example, we've engaged Pontiac City Council. We have Oakland County Health Department on our team. We have Oakland University, people who have some influence and decision-making power that can change policies, for example. And just keeping that going and involving multiple sectors who can change systems rather than, implementing one small program and, only raising awareness and doing things in those piecemeal types of efforts. We're a collective impact entity. So bringing everyone to the table, including those who have some decision-making power, I think is going to go a long way. And certainly it's not going to happen overnight, but over time, I believe that we're going to go from this moment in time where people are excited about something to really making some changes. And it's something that I think I'm committed to, Jessica and Elizabeth are committed to doing, and we will definitely over time see some change.
So with that, Elizabeth, if I can ask you, because you are one of the co-chairs, have you found through the pandemic that it's really forced organizations to come together and work together, but also to think outside the box?
Yes, organizations have really came together. I think it's become even a stronger partnership. So really what's cool about the coalition, there's so many organizations. So we have over 60 organizations that come to the table and bring ideas and bring their network. So I think it's really empowered us as a group and a collective to get stronger. There's so many more voices at the table. There's so many people bringing their experience during the pandemic and previously before the pandemic. So we just have this melting pot of ideas. We have a melting pot of people coming together that are willing to do their part. And it's amazing how many people really want to do this work and show up for our residents and community members in Pontiac.
So if I can ask you, Jessica, as someone who is an educator, it's one thing to provide the information. How do you take that and help them implement it into day-to-day habit changing and a new lifestyle?
It takes, I think the biggest thing is relationships. And as we've touched on, over the course of this interview, if you will, that, building those relationships with folks so that they feel comfortable learning from you, trusting the information that you're giving them, and then realizing that they have those touch points or those people to come back to, that if they have questions or, need a reliable resource, they know where to go.
And one of the things, sometimes we hear about these programs and trying to reach out can be a little bit overwhelming, but they're available. You just have to do a little research and do the follow-up with that as well. And Lisa, if I can ask you, by the way, I'm naming you the Fab Three.
Yes.
Love it.
I think you need shirts made, the Fab Three,
All
because this is such a great program. And what is the highlight, do you think, and the positivity that came out of the pandemic for you and your organization?
I think we mentioned it, just the resilience, the ability to adapt and to continue forward in a way where we had the least amount of disruption. Certainly we couldn't come together in person, which was something that people looked forward to, with our meetings and events and things. But people were able to pivot and say, okay, this is important. We need to keep going. We need to figure out a way to do the work that we do collectively, and as well as, all of the work that goes on with each of the member organizations or individuals. People really just rose to the occasion and adapted. And I think that is such a testament to just the commitment of our members and the commitment of the coalition to really make Pontiac a beautiful, healthy place to live.
And Elizabeth, how can people find out more information if they want to get involved?
Yes, you can go to our website at healthypontiac.org. We're on Facebook. There's so many opportunities to get involved, but I would say our social media platforms are the best way to access us. And definitely reaching out to anyone on the Fab Three to get some more information. So we're
See,
definitely willing.
it
It's already
sticks. It
catching on.
sticks.
It is.
I love it.
Well, we so appreciate the three of you for not only taking time to be with us, but also your commitment to the city of Pontiac and all of those, because we do know that we're only as strong as the communities around us. And we need Pontiac to thrive and survive and to become the great city that it can, because it's going to lift up our entire community. So we thank the three of you for all of your work as well.
Thank
Thank
you.
you.
Thank you so much.